Hello everyone, welcome to MedDevice. In this video, we're going to be looking at the shunts and the respiratory system. So let's start. So basically, we have to see what is the effect of shunts on the respiratory system. So first, you should know what exactly are shunts. So shunt is a term which is used to describe the redirection of a portion of cardiac output or blood flow. We'll understand more of this in a bit. So there can be physiological and pathological types. So let's start with the physiological ones. So an example of physiological shunt is bronchial vessels. Now don't get confused. The blood in bronchial vessels is not the one which goes to the lungs to get oxygenated. It is the one which supplies the tissue of the lungs. Because as any other tissue in our body, even the lungs tissue needs oxygen to survive, right? So this is supplied by the bronchial vessels. So we have the bronchial artery which goes to the lungs and supplies the tissue of the lungs, and then the bronchial veins which carry the deoxygenated blood. Now where does this blood go exactly? So this blood actually drains into the pulmonary vein or left atrium. Now did you notice anything interesting? This bronchial vein actually has deoxygenated blood, but it is draining into pulmonary vein which has oxygenated blood. This is the reason we say that there is a shunt. Let's try to understand this more with a chart. So you have right ventricle. Blood from here goes to the lungs to get oxygenated. Now this oxygenated blood goes to the left atrium and then left ventricle. Now this bronchial artery which arises has oxygenated blood in it. This bronchial artery goes to the lungs and supplies it. Then the bronchial vein carries the deoxygenated blood and drains into the pulmonary vein. So you can clearly see here that the deoxygenated blood from the bronchial vein is draining into the pulmonary vein which is oxygenated. Another example is Thebesian veins, or also known as the smallest cardiac veins. So this carries the deoxygenated blood from the myocardium and drains into the left ventricle. Here also you can see that the veins which have deoxygenated blood are draining directly into the left ventricle which has oxygenated blood. So again here there is a shunt. You can even see in this diagram we have the Thebesian veins. You can see it is supplying the cardiac muscle and then it is draining directly into the left ventricle. Secondly, you can see the bronchial artery. You can see that this artery is arising from the aorta. It is then dividing into capillaries and is draining directly into the pulmonary vein which has oxygenated blood. Now let's come to the pathological shunts. So there are two types of shunts that you should know, the left to right shunt and the right to left shunt. This is seen in conditions such as VSD or ventricular septal defect and ASD or atrial septal defect. So basically the wall between the left and right atria or the left and right ventricle is damaged or not present. The blood can go from the left side of the heart to the right side or the opposite, from the left to the right. So first of all, let's see the right to left shunt. So what all are we going to see here? So there will be a decrease in the partial pressure of oxygen and hypoxemia will always be seen. We'll understand why in a bit. The hypoxemia is not corrected even after giving 100% of oxygen and is seen in conditions like tetralogy of Fallot. Now let's understand why hypoxemia is always seen here. So imagine you have a VSD and you have a right to left shunt. Now the blood is going to go from the right side of the heart to the left, and so the blood in the pulmonary veins will decrease. If there is less blood in the pulmonary vein, less blood is going to the lungs, which means less blood is getting oxygenated. If there is less oxygen in blood, this will lead to hypoxemia. So the blood that is diverted will continue to mix with the oxygenated blood, meaning the blood from the right ventricle will keep on going to the left and will dilute the oxygen content. Now let's try to understand the left to right shunt. So this is more common and is seen in conditions like patent ductus arteriosus or traumatic injury. It does not lead to a decrease in the partial pressure of oxygen, and hypoxemia is usually not seen. The partial pressure of oxygen is increased on the right side of the heart. Let's see why. So imagine again you have a VSD and the blood is now going from the left side of the heart to the right. So the blood then goes to the pulmonary veins which gets oxygenated, comes back to the heart, and then this oxygenated blood again goes to the right side to get oxygenated. So the blood will keep on getting oxygenated again and again. And because the blood is being pushed from the left side to the right, there will be a lot of blood in the pulmonary veins. So just to summarize, some of the oxygenated blood that is just coming back again goes to the right ventricle and gets oxygenated again. This is why I had said that the partial pressure of oxygen is high on the right side of the heart. And the final point, the pulmonary blood flow becomes higher than the systemic blood flow. Why is this? The same reason that the blood is going from the left to the right side of the heart, and so less blood is going to the systemic blood vessels, which leads to higher pulmonary blood flow. That's it for this video. If you have any doubts, so please leave them in the comments, or you can message me on Instagram anytime. I'll leave the link to my Instagram in the description. Thank you.